name is Alex. I have a 7-year-old son and a wonderful 72-year-old mother who is suffering from dementia and requires full-time care. My son is in 2nd grade. My mother is in a nursing home, and I work full-time. The costs of childcare and of elder care are staggering, but simultaneously, the professionals that help care for both our children and our elders are generally underpaid, which makes it difficult for them to support their own families and do the jobs that they need to do. How do you propose to help bridge this gap, making both child and elder care more affordable for hardworking families, and also retaining and attracting quality talent for these essential jobs?
So first of all, you're dealing with a lot. You're dealing with a lot. And I just wish you strength and support. You are a part of what we call the sandwich generation, which are those parents and children who are right in the middle. They are taking care of their young children and taking care of their parents as they age. And it's a lot. And so I actually plan to address this in a substantial way because I actually bring a personal experience to it as well. I took care of my mother when she was sick. And that work is the work of trying to cook something that they feel like eating, right? Trying to figure out which clothes will not irritate their skin and help them put on a sweater. It's about trying to figure out how you can say something that brings a smile to their face or makes them laugh. It's about dignity. Meanwhile, you have a 2nd grader. You try and teach that kid how to read. Spending time with them, reminding them they are special and can be anything. And in the middle of all of that, if you are working, or just to have a minute to breathe, it's a lot. It's a lot. So the way that this plays out for many people is it's one of just a couple of ways. One, if you have the good fortune of having enough extra money, you can hire somebody to come in and then, exactly as you said, you, knowing what you just shared with us about yourself, would pay them the value of their work. Or someone in this position would have to basically spend down all their savings so they could qualify for Medicaid, which means they pretty much have to get rid of everything. Or they have to quit their job, which means one less income in their household. And this issue for me is a matter of dignity. Yours, your parents, and the well-being of your child. And you being able to do what you naturally want to do, and the thing that we should value in our society, which is someone like you who is taking on the duty and the responsibility of all of that. So my plan is that instead of those scenarios I just mapped out, we will restructure it so that Medicare covers the cost of in-home health care for your parent so that they can be at home and you can then have the assistance with someone who can help prepare that meal, help them get dressed, and you can still give that baby of yours all the love that they deserve, and you can have sanity in the process, and everyone can have dignity. And so this is my approach, which is let's just look at this as let's just come at it from common sense, by the way. It's just common sense. And what is a common sense practical approach to doing this? Because when you are able to be productive, we all benefit, by the way. When that child is able to have a parent who is able to help them with their reading and remind that child that they are special, we are all going to benefit from that. So thank you for raising the subject.